Morning. It's great to see everybody this morning with your coffee mugs, hopefully bright and early. I have my coffee mug right here. So I'm Dipti Chaporia, president of the American College of Cardiology, and I'm thrilled to welcome you to our virtual coffee table. So throughout my presidency, we've come together once a month to talk about great ideas, innovations, hot topics, and more with really fascinating guests from the world of cardiology, medicine, healthcare, and beyond. This series has been such a joy for me, and I hope that it has brought inspiration and knowledge to all of you that have tuned in. And I know that many of you have tuned in from almost all of them. Whether it's for one specific session of interest or if you've joined us every month, thank you so much. It's really been an immense pleasure for me. So today we look forward to an interactive session with our fantastic guests, Dr. Stefan Achenbach and Dr. Fausto Pinto, and have really allotted the last half of this discussion for open Q&A from the attendees. So conversations and takeaways are always welcome, of course, on Twitter, and please use the hashtag ACC Coffee Table for your post today. And really a reminder for virtual engagement, please remain muted when you're not speaking, and we encourage the use of WebEx chat feature. At the end, we hope that you will be able to join us for the question period. And if I call upon you, I really hope that you have your camera ready and you can be with us and ask your question and chat with us so that we can see you. If you're viewing this live today on the WebEx application, please click the layout button in the right upper corner, and under stage view, click stack for the optimal experience. So without further ado, I'm joined by two exceptional cardiology leaders and leaders of two incredible cardiovascular organizations, Dr. Stefan Achenbach and Dr. Fausto Pinto. Really, we're going to talk about global togetherness. And so let me introduce to you both of them. Dr. Stefan Achenbach graduated from the medical school from University of Nuremberg, Germany, and completed his training at the Associated University Hospital. He went on to be a research fellow at the Department of Radiology and Cardiology at Mass General Hospital. And then since 2012, he's been the chairman of the Department of Cardiology and professor of medicine at the University of Erlangen, Germany. His research is really focused on cardiac interventions and cardiac imaging, with a special focus on CT of the heart and the use of imaging to support coronary and structural interventional procedures. He was the founding president of the Society of Cardiovascular Computed Tomography. He's been the editor-in-chief of the Journal of Cardiovascular Computed Tomography, and he serves currently as the president of the European Society of Cardiology. So we're honored today to welcome Dr. Stefan Achenbach to the ACC Coffee Table.
It's my honor, Dipti. Thank you for inviting me.
Thank you. Our second guest today is Dr. Fausto Pinto. Now, I've known Dr. Pinto for a long time because when I was a resident, he was there as a cardiology fellow. So Professor Fausto Pinto received his medical degree and PhD from the Lisbon School of Medicine, University of Lisbon, Portugal, and he completed his fellowships at the Santa Maria University Hospital and then Stanford University Medical School. He's a dean of Faculty of Medicine of the University of Lisbon, professor of cardiology, and head of the cardiovascular department. He was president and founder of the European Association of Echocardiography and president of the European Society of Cardiology. He is the current president of the World Heart Federation, and he was chief and editor of the Portuguese Journal of Cardiology for many years, and a member of the editorial board of several international journals. His main areas of interest are ischemic heart disease, anticoagulation, cardiovascular imaging, particularly on the use of ultrasound in cardiology, and he pioneered the use of intravascular ultrasound in the study of graft atherosclerosis. And he just told us that he's 25 years as a member of as a fellow for the American College of Cardiology. So welcome, Dr. Fausto Pinto. We're so happy to have you here today, and welcome to both of you.
Thank you so much, Dipti. It's a pleasure and an honor to be here with you. Thank you for the invitation.
So, first of all, I've been really excited about talking to both of you. These conversations, you never know where they're going to lead, but I think let's start off with, the three of us represent the world of cardiology. And, there's been a lot, as you go through the journey of being presidents of our respective organizations, and particularly, in this pandemic zone, there have been a lot of things that I know I've looked for silver linings. I'm one to look for silver linings. And so there have been there have been silver linings. There have been many lessons that I've learned over the year. I want to know what you think are some of our common concerns as a cardiovascular community at large, and what are some of those lessons, and how have they highlighted some of those concerns and some of the things in ways that we've come together? Because I believe that we've come together in an incredible way through the pandemic, sharing best practices and really coming together as a global community. So that'll be my first question that I put out to you guys.
Bill, if I may start,
Yeah.
I think the global pandemic, the COVID-19 pandemic, and there's now data. It's always good to look at the data. Has shown us that cardiovascular health is important for the resilience of the population against other diseases. We have the very good data now that patients, particularly with heart failure as a pre-existing condition, suffer more from COVID-19 and have higher mortality rates than others. And this is data from all parts of the world. And I think this is something that is not just the cardiovascular community has learned, but the population at large and the politicians and the leaderships have learned. Health is important for resilience. So that's one lesson that has been learned very, very painfully. And I think that's a global lesson that has been learned everywhere and together.
Yeah, also, it's clear that for the preparedness for a situation like the one that we lived, we learned that if there is something that should be done, and actually WHO is working on that exactly, is to continue to reduce and be even more strongly doing the utmost to reduce the burden of cardiovascular disease, because as Stefan said, patients with cardiovascular conditions were the ones who were either more infected, or when infected, they had more complications. And actually, even the complications related with the fact that in many cases, there was some sort of neglected cardiovascular conditions, and of course, other conditions as well, because of the pandemic. So to reduce the burden of disease, it's going to be one of the big challenges, and actually one of the ways to be more prepared for future either pandemics or other health issues that we may be facing with. The other important element is to actually access to care, because I think what is being clear also is the fact that the access to care is fundamental if we want to achieve good results for healthcare. And that was actually the pandemic, what happened around the globe was actually a major impact on access to cardiovascular care. And all of us are still suffering and still having to deal with backlogs of different conditions. The fact that many patients, despite the fact of telemedicine and telehealth and so on, but it's a fact that many patients were not properly treated or managed, and that will have an implication in terms of managing conditions such as from hypertension to dyslipidemias to many other factors that will certainly have an impact in the future. So those are some of the concerns that I think we should have, and some of the aspects that were raised by the pandemic, and some of them also demonstrating, and that's another issue, the fragility of some of the health systems around the world. And that's also the relevance of having a strong and promoting more support for healthcare and for the healthcare delivery is certainly something that we have to push from our side as medical community to ensure that there is proper access and proper conditions to take care of our patients.
Faster, you're thinking you want to add something else on, I can tell.
You mean me?
I mean, Stefan, I'm sorry. Yes, Stefan, I can see that you're thinking about something else and you want to add
you were starting about things that we have learned, and now it sounds almost flat, like saying this over and over again, but I have been thinking about it's absolutely true. It's in difficult situations, it's necessary to work together. And if it's done right and it takes some leadership, it can bring people together. It starts on a very small scale, maybe in my department. I see right now we are so massively strained because we have a lot of patients and so many patients, so many staff out with COVID or for isolation for COVID. Unless you work together, and we are unified this in our department, by the problem that we're facing jointly. But you can translate this to the hospital at large. You can translate this to the national cardiac societies. You can translate this to the three of us working together. I think, facing this problem that we all have the same way, this really shows that working together is necessary, and also brings us together to some extent. I really think that's really true.
You know, one of the things that we just have had a recent discussion about is this shortage of key clinical and support staff in the hospitals. And we called it a national staffing crisis. And we actually had a webinar about it. Now, we know that that's a real problem in the US, and we believe that it started before the pandemic. Have you all noticed that around the world?
Yeah, I think that's happening in many places, and actually, what we are seeing also in Europe, for instance, is the fact that a few years ago, medicine was by far the number one area that the students will choose for their careers. And what we are seeing today in many places is actually not anymore the number one, and that's related with many factors. The fact that you have long studies, long courses, that you have to achieve a level where you can be at the more senior level, it takes quite a lot of years. And compared with other professions that are, let's say the return on investment is much shorter, that actually shifting many people and many youngsters to go into other professions, because the stress, the burden, the all even the burnout, if you will, of the medical profession today, and sometimes the compensation or some of the other aspects are perceived as not so exciting. I think that's shifting away some of the youngsters, and that you are seeing that even before the pandemic, you were seeing that as well. So I think that's probably one of the factors. So the value of the medical profession, and to demonstrate, what is the real value of being a doctor, and what is basically the why do you become a medical doctor, and what is in the profession that can be attractive. And it's a little bit our responsibility also, as, let's say, senior doctors and senior leaders in the field, to ensure that this profession has to continue to be, on one hand, challenging, we know, but it should be attractive, and we should do our best to make it attractive. But of course, there are many factors that at the moment are unfortunately pushing away some of, and many times, some of the best in the society. So that's a problem that we really have to face. We have to deal with and try to find what are the solutions, or some solutions that can improve the attractiveness of the profession and for the new generations.
Well, there's very specific numbers. I mean, every society, every country is a little bit different in the makeup of age and the population pyramid that we talk about. But in Germany, you can basically say that people enter the workforce at the age of 20 and they leave the workforce at the age of maybe 65. And we have more people leaving the workforce every year, about 1 million, while only about 700,000 enter the workforce. So the workforce is becoming smaller and smaller. So healthcare is competing, not just doctors, even more so the support staff that you mentioned, is keeping for these few young people who enter the workforce. And we have to compete with them with other professions that are more attractive, as you mentioned, Fausto. And we have to take care of more older people on top of it. So this is a problem that is just building up in front of our eyes. And I think it's probably the same for many Western societies, that more people leave the workforce than people enter the workforce. So we are in fierce competition, particularly in the area of the support staff. That's one point. And another point, now this is a very personal thought of mine, and I hope I'm wrong, is that the values have changed. If you think 1950, 1960, 1970, it was a value to care for others. It was considered something that you strive to do, caring for others. But now we're living in the me society. Of course, there are still many, many people who want to care for others. Luckily, there are. But the trend in society is it's all about you. What's in it for me? Caring for others has become, it's still a value, but I think it has become less of a value than it has been in the past. And we in the medical profession, particularly in the support staff, it's a lot about, people try to find a job, we're looking for a job, found fulfillment in the job where they were caring for others. And I think this has become less in the society, because we're constantly being told you have to look out after yourself. What's in it for you? What can this do for you? Self-fulfillment. Caring for others has become less of a value, I feel. I hope I'm wrong, but I feel I'm not completely wrong. So this is also something where part of what made our profession, the entire area of healthcare, attractive in the past is no longer not considered so attractive as it has been in the past.
So how can we change that? How can we change that? I just said we represent, I mean, how can we change that fundamental perception?
Well, the society, and that's true, is becoming very, very selfish, and that's not new. The pandemic maybe made it a little bit more clear because with the isolation, people being even more isolated, it may even translate it into more selfishness. But it's true that the values are unfortunately are changing. And I think here it's a little bit the responsibility of the leaders, and in this case, in the medical field of us and many like us, to ensure, although it's not so easy to find the best solutions, but by on one hand to promote those values and to be in a way the players that and the role models that can be perceived, particularly by the younger generations, to work also, and I think that's very important, particularly now talking about the healthcare, to work closely with the decision makers, because that's something that sometimes we in the medical field sometimes are not so good at doing, although some societies already have been working on it, and ACC is a good example of that, and ESC and some others trying to have that sort of link. But it's important that we continue to work closely with the decision makers, with governments, with basically the ones that have to decide for the society, for the importance of supporting healthcare and supporting the best possible conditions for the healthcare providers and for the healthcare as a whole. We do know that that's a complex issue. There are many factors involved there. But in a way, we have to be, if we are not the messengers of the right messages, then who will be? Who can be the best messenger for all those aspects related with what should be proper conditions for on one hand, the healthcare per se, but also the ones who are going to perform those tasks. And I think it's a big responsibility for all of us that in a way and that's why it's important that we work together, and that's why it's important also to societies or organizations that can really help each other to find the best solutions, or at least the best suggestions, the best examples, even with differences that have to be, of course, applied with some local flavor. But that's also the role of these organizations, trying to find together some models that can be implemented. And again, this is a dynamic process. We have to use the new tools. We have, in a way, to be smart enough and wit enough to use the tools that can help us to promote what we believe in. We believe in being a good healthcare professional. We believe in the values that are the Hippocratic basis of medicine, and that's reflected in the society. So I think that's this may sound a little bit naive on one side, but on the other side, if we don't do that, then we can go into a very hard road, and we can go into some difficult, even more difficult future. So a lot of work to do, but certainly here, working together, exchanging models, ideas, ways to put things in a perspective that can be perceived as relevant and as being sufficiently able to be an incentive for the new generations to go into this profession. But the problem, and I agree with Stefan, is very much in the society itself. And there, again, we are players there. We can have a role, but it goes a little bit beyond that. But our role certainly will be very relevant for the future if we want to be successful.
But as Dipti mentioned, I'm even more worried about the support staff. And recognition is maybe a small step, but a super important one. But probably those who are in this talk, having coffee with the ACC president on a Saturday morning at 7:00, they're certainly the ones who will also be extremely supportive to their staff in their institutions. And this is where it starts, right? Giving them recognition and realizing that their jobs are extremely important, and telling them when they do a good job. So it's not, preaching to the choir, I guess, here in our circle, but something that is very important on a smaller scale.
So, and you've been working on this topic, I know, on wellness of healthcare providers and the relevance of provide the best possible conditions, dealing with burnout and with all the, which was actually quite relevant in the last couple of years, and even probably more amplified than we used to see before. And I know that you've been particularly interested in this topic, and I know also that some communities and some hospitals are now dealing with this topic, particularly now after or during this pandemic, where all these issues related with the wellness of the healthcare providers, it's so important. So I think that's another area where we must work again and try to find what can be the best solutions to improve wellness of our peers and our colleagues and our all the staff, basically, that not only medical doctors but all the staff working at hospitals or clinics or providing some sort of healthcare, because you can only be efficient and be, if you are in good condition, if you are in good shape, if you are happy enough to deliver what you have to deliver from a professional standpoint. Otherwise, you're going to be part of the problem and not part of the solution.
Well, one of the things that struck me is what you said, Fausta, earlier. You said one of the things, and I've said this, and I wrote this into my leadership page, that the pandemic really highlighted how much health matters, right? We've just said that. We all agree on that. I did a coffee with, Vincent Covello, who's a world expert on stress communication. And he said that we need to maybe use this opportunity right now when everybody believes that health matters to communicate how much caring is important and how much health really matters. Like maybe really highlight that. And is there an opportunity now, given the fact that people think health is important, for us to influence the generation to not only enter the field, but to sort of really start having the conversations about health in a meaningful fashion to really, tackle some of our common concerns. I mean, we continue to have a global pandemic of hypertension, diabetes, all of that. So I wondered if you all thought that there was an opportunity for us based on where we are mentally to change this conversation and the way that we communicate, and what is our roles as a global cardiovascular community to do that.
Oh,
Well,
absolutely.
pause,
Go
please.
ahead. No.
The pandemic has given us leverage, right? So we can make very good points, and we must not fail to make these points. On the other hand, while you were saying this, and I think we agree that we must use this opportunity to emphasize to the public leadership and to the politicians how important healthcare is. At the same time, we have come to the painful realization that there's a much higher percentage of the population who are completely irrational as far as medical healthcare goes. Much higher percentages than I would have expected that say no to the vaccination, for example. In Germany, there's still 25% who don't want to get vaccinated. Can you believe it in an educated society? So I have realized, completely different from what I thought in the past, that there are much more people than I would have expected who are completely irrational as far as trying to educate them about, what is healthy, what is not healthy, what does a certain procedure do for you, what not. This very high percentage of the population who think they know better and the vaccination is no good. It's really, really amazing.
This is actually a very important topic, and actually, I think we were all a little bit surprised with the numbers that we are seeing in some places. Fortunately, in my country, we had a very high rate of, in this specific case, of vaccination. Although we had, of course, also some of these people anti-vaccines and so on, but was a relatively small percentage. But this has to do with what you said, Dipti, and it's about communication. Mm-hmm. And that's something that's the other area that actually had a big push with the pandemic is, and actually now you see these experts in communication and in health, not only in the healthcare area, but also in terms of communicating with the population and communicating these communication strategies that are even governments have created these task forces to and these communication specialists now. And I actually think that that's a very important area, and where sometimes we are not so good. We as a community are not so good at it's communicating with the lay people and communicate in a way that can be efficient, because it's not only saying the right things, but how we say it, and how this can be done in a way that can be efficient and actually can have an impact. And it's clear that we miss that in many ways. You know what Stefan just said. You know, can we imagine in an educated country that you have 25% of the people against or somehow having an anti-scientific position? So that's something we should also debate, not only criticize, because it's easy to criticize, but try to understand why. You know, why is that happening? You know, why we in a way failed communicating with our people. And there's been a lot of discussions on that. There was actually, I was in a debate where one of the issues, and it was actually in the US, was the fact that in some areas it was perceived that there was a mismatch between the messengers, being the health professionals providing the message, and the population. And in this mismatch, actually, the message was lost. And other explanations, for instance, in some countries that were more used to have, let's say, a more authoritarian government in the past, they would tolerate less somebody tell them to do something. So there was sort of a reaction again, and that's when the indication was for the vaccination that was interpreted as an order. And so there was kind of a reaction against. So there are many interesting aspects that we actually should look at, and in a way try to understand, so we can actually improve the way we can communicate with the population. And this was an excellent example, the pandemic, on the negative side, on how not communicate in many ways, and try to understand, you know, how, where did we fail, and where did the let's say the scientific community in a way fail providing that sort of message, and how we can improve that, and how we can improve, because at the end we all suffer with that. You know, vaccination is a very good example. We could talk about other areas, as you well know. The other areas is about statins, for instance, and that was before the pandemic. There were a lot of also people, let's say, against the statins, and there were even pressure groups in different countries. You know, and you wonder, you know, why, and then all these conspiracy theories and all these sort of groups that in a way live out of this sort of fake news world, which is something that we should fight it, and we should try to, but we have to fight in an intelligent way. And that's where, again, to use the best methods to understand it, and to build up communication strategies that can make us in a way efficient on the way that we can communicate that and reach out to the population. So I think those are all important issues that, again, this pandemic brought up, and that we have to try to find, and I know there's been a lot of discussion on that, to try to find what are the best solutions to reach out to the population, and try in a way have a vaccine for this anti-science posture that we've seen in many parts of the world.
Yeah, I think. Go ahead, Stefan.
It's a good and a bad. I mean, the pandemic has brought about a massive increase, at least the way I see it, in digital communication, both for patients, individuals, the population who receive data from digital sources, which of course includes the social media, but not only social media, but also what, you know, we communicate now very elegantly and relaxed in an online fashion. Like, you know, 2.5 years ago, we might not have. So the increase in digital consumption and exchange of digital information has been probably propelled forward by the pandemic. It's an opportunity. You know, we had good comments in the chat saying we have to take care of more patients with the same workforce in the future. So digital certainly is going to help. But includes the social media, and the social media have this massive problem of the filter bubble. And I think we're all realizing how massive this problem is. A massive problem that impacts society. And this is part of the explanation, I guess, for all that Fausto has said, that some segments of the population are really hard to reach and develop their own opinions and become very, very entrenched with their own opinions. The filter bubble is a problem that will accompany us for the next decades until a solution is found somehow, but it's a massive problem that we don't think about enough.
Well, but I
it's
wonder
irreversible. The social media, and I know that even some of our colleagues are a little bit, let's say, not against, but sort of you know, look with a suspicious eye. But it's clear, and particularly for the new generations. I use social media, and you actually, all of us use social media, because I know, because we follow each other. But it's true that this is Yeah, but this is one area where again the new generations are very much into, and that's where we also have to find solutions to make it work. And but because it's a totally new, this did not exist, when we a few years ago. So it's something that's totally new with a totally new dynamic and rules that are totally different from what we were used to use in the past.
Well, but you both brought up incredible points. But I just wrote about how maybe this is an opportunity for us to communicate science differently. I mean, during the pandemic, people wanted to know right away. They were afraid their health mattered. They wanted news on, but the way we communicate science, first of all, science takes a while for science to evolve. And then how do we really make sure that the data is correct and then perpetuate that data? All of that takes time. How do you do that in the social media world? And so maybe we all need to reflect on how we go forward in terms of communicating science as it evolves. And I know I just wrote about this. I think this is, to me, one of the things, and I wondered what you all thought about that. Because how do you rush that? How do you, I know people want that information right away, but you can't rush that information.
No, absolutely. And actually, one of the problems, and there was actually a big problem also for the politicians, is that science, we have a lot of questions, we had a lot of doubts, we don't have absolute certainties, and many times what we test today, it may bring results that are totally different afterwards, and that's science, because science is based on data, and it's evidence based, and that makes life a little bit difficult for the rest of the population, because they want answers, like the politicians. I think one of the problems that we faced in many places was the fact that politicians, they wanted to have absolute certainties to take their decisions using the political matrix that they are used to. Although here was totally different, because it was a health issue, and with this type of the biological behavior of a virus, or of the reaction of a body to a viral infection, is not something that you can totally predict with the certainty that a politician would like to have. But on the other hand, you're totally right. This and this is part of the educational process. It's and also it will impact certainly on how to communicate. And you are totally right. The way, and that's why we were talking about these communication strategies and these different communication tools that now, in a way, have been pushed forward, have been developed, have been different from what we are used to. Also, in particular in social media, is the emergency. You need almost an immediate response, and that's something again that it might prove very dangerous, because then it can create that's because it can be A, then the next week is B, and then it's C, and that creates suspicious in the population. So there is some work here to be done in terms of how to communicate science, and in communicating science, because we are dealing with one area where, again, to be in doubt is the essence of science, because you cannot be absolutely sure, particularly when you are on a developing mode of certain area, and that's exactly what happened now. But again, this brings us to the discussion. Okay, so how to do it, and how to be, again, efficient in the way we do it, so we don't create this sort of suspicious mode in the population, that at the end it's easier to believe in these fake news and these groups that are very assertive and very so. And again, here I think the credibility of the scientific community is in the medical community is fundamental, because we have to create trust. We have to engage. That's why it's important that organizations such as our organizations are also engaging, let's say, patient populations, patient groups, and other groups, in a way, co-creating ways of communicating with the population, and that's going to be essential in the future. So it's changing. We're learning as it goes, and we certainly again have a lot to gain with each other, trying to find the best methods to do that.
reading Twitter is not a systematic review, right? And for the public, it's very difficult to separate the two. You find, 8 studies that point in the direction that you like to read. So Twitter feeds you more of the same. The systematic review forces you to look for information that might potentially, point the other direction. And this is the role of the professionals and also the role of the professional societies. Communication has always been part of medicine, very, very important, like auscultation or whatever your manual skills in surgery. And probably communication has now become more important because patients can get their own information, or the public, even before they become a patient, now can get their own information in a much larger scale than they used to before the social media and all the online resources came up. So our communication skills are required more than ever, and both on an individual level and also as a level of professional societies.
So I want to pivot a little bit. We just talked about the pandemic. So we've been sandwiched between the pandemic and now the war in Ukraine. And I know that in times of global crisis, I think that we should talk about, as we are a global cardiovascular community, the force of the global cardiovascular community to come up with solutions, to be a force to help larger problems in the world. Dr. Mueller at Brigham and Women has been part of this international physicians for prevention of nuclear harm. And, it's been suggested that we can utilize our power as a cardiovascular community, global cardiovascular community, to solve a lot of problems and to really help the world live in peace. And we talked a little bit about some of the solutions in terms of health. Tell me some of your thoughts. What can we do as a force, as a global cardiovascular community? How can we continue to keep our communities close? And what are some of the things that we should tackle? Again, really open-ended question, I know.
Okay, I can start. I think we can, of course, I totally agree with you. We are, as a global community, and I would say that the medical community as a whole is probably the most global community in the sense of having the same values at the global level, having the same concerns, because we have to deal with the issues related with the health of our patients, of our populations. We have to deal every day with sick people, with people who are very much dependent on the healthcare providers, of the medical doctors or others, to help them to overcome difficult situations which have to do with impairment of their health. So I think we have, I would say, a special touch to have those sort of common values and common approach. And in that sense, I do believe that we are really a global community. So by working together as global organizations and providing that sort of recommendations, that sort of set those examples, work together with our, either at the central level or even at the local level, with our authorities, with our decision makers, with central organizations that can be global organizations or more country or region organizations. I think it's a little bit our responsibility, again, through those different channels that we all have, to continue to promote, of course, peace. That's clear. I think we all agree on that. But also how important it is, regardless of the situation in a certain place, that every human being has the human right to be taken care if he or she is sick. And that's one of, I would say, basic human rights: the right to healthcare, the right to be treated, the right to have access to some form of medical management. And that's actually something that even in war times should be respected. It's actually in the Geneva Convention that was signed by all the countries. But so those sort of let's say positions are fundamental, that will continue to be promoted by the global medical community, and particularly by organizations that have that role in terms of representing the health professionals, in our case, the professionals in the area of the cardiovascular system, which, as we know, it's still the number one in terms of morbidity and mortality. So I think we do have and we should continue to promote that role, and we should do our best to be certainly the messengers of, on one hand, peaceful messages, of course, but on the other hand, to continue to promote that these human rights should be respected everywhere, and in every single place on earth, there should be some sort of reaching out to those in need, and regard even in harsh conditions as the ones that we are seeing, unfortunately, in some parts of the world.
Yeah, nevertheless, I mean, even though we want to completely right with everything you said, as usual, Fausto, you're so experienced with leadership and global communities and bringing people together. But I mean, we can't escape, even though we would like to say that medicine and science brings people together, that at least I feel very helpless at the moment, right? We have been working unbelievably well together in the European Society of Cardiology. We have been working very well together globally in science, in medicine. Yet things are happening that are simply terrible and that nobody would have imagined. So it leaves also, there's no cure for it, the feeling of helplessness. This war, this attack is absolutely horrible and terrible, and there's absolutely no easy solution to it that we can in some way do by bringing people together, and everything will end. It's a terrible wound, that we're having in our society, and there's no easy cure that, at least for me, leaves a very helpless feeling. And we also, we mentioned this before when we were talking. Yes, medicine brings people together, but I think we should be a little bit, maybe humble here. It very much the same holds true for other areas, completely other areas. Let's take music, where there are orchestras, where individuals from all nations play together, and they don't care the least bit where they come from, and music brings them together. Or other areas of science, let it be astrophysics or chemistry or climate change, also something that concerns everybody. Everybody loves their children. Everybody wants their children to live in a healthy world, wherever in, whatever continent these scientists are on. So there are other areas which also bring together people like medicine. You're right that there's this particular aspect of medicine of caring for others, but caring for the future is something that other areas where people work together also have. So we shouldn't consider ourselves too isolated here. Not that I have any solutions, but just to point out that we're not maybe in some respects not as privileged as some people might try to tell us. Yeah.
No, I think you are totally right, and of course, in the ideal world, this should be the role of everybody, basically, and everybody should be taking care of each other and should be able to respect and take care of the others. I still think that it's not being privileged, but the fact that we are maybe more, as medical community, maybe more used to deal with suffering every day. We see suffering every day. So that may give us an extra, it's actually the opposite. It gives us extra responsibility, not being better than the others, but being in a way, because we are more alert for the suffering, and because that, again, is part of our job, is part of our profession. Maybe we have that extra responsibility, or let's say even more responsibility, to engage in what Dipti was saying about this sort of global community, to push for peace, to push for healthy world. And of course, everybody should be pushing for the same side. It's true. But as we know, in any parts of life, we always have who's leading and who's following. And in this specific case of global health, I think we do have, as medical professionals, we do have a special responsibility. We should engage everybody, of course. We should be, in a way, the educators, or be the ones who have more access to all these different elements that, again, will put on our shoulders that responsibility to be the catalyzers of this type, and in a way to promote this dynamism of being able to have this global approach. But you're absolutely right. Sometimes it's very frustrating, and actually, just what is happening right now is very frustrating. But we should not give up. It's again, sometimes it's even in these difficult situations that we have extra strength to being more pushy, and to push things in a way to show what is the so evident. What you said is totally true. People love their kids, love their family, their loved ones. So that should be obvious, that we should all take care of each other. But when that does not happen, then somebody has to take the lead. And I think here the responsibility of the health professionals is, I would say, is even more in terms of promoting that and being the dynamic part to promote that sort of solutions. Not easy, of course. The humankind is can be very unpredictable. But again, it's a little bit on our shoulders try to find out how we can do better to be more efficient and at the end to touch more people's lives and to be in a way the agents for a better world. It may sound a little bit naive, but that's what we want, and we should not give up. You know, we should not surrender. We shall never surrender. We should always keep moving forward.
I mean, if I may, Dipti, I'm sorry, I don't. But in the chat, there were a few comments. I think I'm seeing it here. This very, very difficult decision that the European Society of Cardiology has made to temporarily suspend the memberships of the Russian Society of Cardiology and the Belarusian Scientific Society of Cardiologists. This is a decision that is in no way directed or intended to say that the cardiologists are to blame. Not the least bit, and anybody who reads the statements that the ESC put out can understand this immediately. Not the least bit on blame on the cardiologists in these countries. They suffer from the situation terribly, I know. But in this terrible attack, in this terrible aggression against one country, the world has found one, countermeasure, one measure to try and, reduce potentially bringing to an end, reduce the amount of suffering, and this is sanctions. In this aggression, sanctions have been installed on a very broad basis to send a message to the country that this is unacceptable and has to stop. Sanctions only work when they are as uniform as possible. So the ESC has decided to, as a part of these sanctions, to send a message to the leadership in these countries that the behavior is unacceptable, in the tiny, tiny hope that making the message that the sanctions send a little bit stronger, in the tiny hope that this will, even if this only shortens the war by 5 minutes, even if this prevents the injury of one kid, then it's already worth it. It's painful. Every day it's painful for us that at the moment these two societies are temporarily suspended. I have the best friends in these societies. I know they're not to blame, but I'm sure they understand. Those cardiologists in these societies who are also against the war, and I would assume that it's the vast majority, they understand this message. We're communicating with them. And there is no right and no wrong in this terrible situation. But I would like to emphasize that the ESC, and I think everybody knows this, is not blaming the Russian or the Belarusian cardiologists for this war. It's the sanctions that the international community has used as a countermeasure to make this aggression stop, if in any way possible. And this is what the ESC has decided to join in. So just to explain the position here.
Yeah, and our position was a little bit different. We felt that we agree that I think that our approach was that we need to support anybody that supports the mission and vision of the college in terms of caring for patients. Our Russian colleagues continue to care for patients. And so we thought that reaching them in a different way to sort of influence them for the same thing would be effective. So I think it's a different approach, but the goals are similar. We all want this to end. We don't want any more lives to be jeopardized in any way. But I think it's just a slightly different approach.
And I would like to emphasize that the information flow to the Russian cardiologists, to the Russian and Belarusian cardiologists, is not interrupted at all. They can continue to reach our guidelines. They can use our guidelines. They can, access all the information that we put out. So the influence on healthcare in these countries, no way would we want, to reduce the level of care that a Russian cardiac patient will receive. Through our measures. The information flow into these countries is completely uninterrupted from our side. Nothing has been banned or interrupted here.
Hadley Wilson, I know, wanted to ask a question about, are we doing enough? Hadley, do you want to ask your question, or do you want me to just read it? Hadley, are you still on?
Sorry, coming off mute. So I think our guests have addressed this fairly well. But to be specific, are we doing enough as societies? You mentioned European Society of Cardiology. I think there's others like the European Hepatology Society and others that are outright condemning the war and condemning Russia as a whole and Putin and so forth. Is this something beyond that we need to be doing, or are they're actually asking for societies to band together and have a single voice on this? What are your thoughts?
If I may say something here, of course, I think we all agree that the situation is terrible. It's we all condemn this situation, this aggression. I think we all agree on that. On the other hand, and to be very blunt, this is not the first time, and even right now, there are other parts of the world where there are people being killed. There is war, there is aggression, and of course, in this case, we can discuss, all the elements, and there's a lot that we could discuss around. But in reality, this is not the first time that happens, and it's not. If you see what's happening in some parts of Africa, in some parts even of Asia, in some other places, it's a bit more complex. That's one thing. The second thing is how much we as medical or scientific or professional societies should, in terms of, because we are dealing basically with problems related on how to do the best management for the patients, how to promote healthy lifestyles for the populations, how to promote health, basically. And that applies to everybody, being and the population. Of course, they can be under an autocratic regime or a democratic regime or whatever regime, but the population is still a population. So maybe my position here right now, if I was on a few years ago when I was president of ACC, I might have. I will have the same problems, and I actually followed the situation of ESC, which in this specific case is very particular. But it's and of course it's not. These decisions are not easy. But in our case, for instance, at the World Heart Federation, we followed basically the principle of being a global organization. We would follow basically the whatever the WHO or the United Nations will follow, because at the same time, if you exclude somebody from a table or from a platform, then you actually cornering that country or that community or that, and so it may actually in a way promote more isolation, and you need platforms for discussion, for for exchange. So of course, this is not easy, and this is actually probably because we are not politicians. It may be even more difficult for us to deal with that, because at the end, as Stefan said, we are and Dipti, and we are what we are saying here. We are a global community. I don't feel I'm not different from our Russian colleagues or Belarusian or Sudanese or South Africans or whatever. We are all taking care of patients, of our populations, and that's what makes this so difficult. We should at the same time be very assertive, and I think we did that. ACC did that, of course. ESC did that on condemning acts that are really repugnant and that we cannot support, and that we cannot in any way promoting or but that's different. In terms of the reaction towards the scientific or medical professional structures, I have to confess, and Stefan knows my position on that my I think we should condemn the acts, but at the same time we should help also our colleagues and whatever they are, because by helping our colleagues, we are helping the populations that they serve. Because today they have a regime, tomorrow it could be another one, but the population is the same. and that's where it's a bit difficult to have here. I'm not saying it's right or wrong, and of course this we can discuss this for in looking in different angles, but for me it's more this concept. We are all taking care of people, and people, regardless where they are, regardless of the regimes that they live in, and that's a little bit what I feel.
Oh, I
Well, I
think
think, yeah, I made the point for the ESC, had tremendous discussions. There's also a very good statement out there that says, remaining fiercely apolitical is political in itself. And there is no good and the bad. This attack has created terrible wounds, and terrible wounds are sometimes, impossible to find a simple solution for. And I think I've made the point clear that we're not condemning the Russian cardiologists the least bit. We have not interrupted the information flow to them at all. But at the same time, team up with the sanctions. Paralympics have excluded the sports people from these countries, and how are they to blame? Yet universally, this is considered impossible to have people from two countries that attack each other, playing sports games against each other, and nobody. So sanctions. The ESC decided to go this way, knowing very well that there are different approaches to this, and hoping, like we all do, that this aggression will stop as soon as possible.
So I'm going to pivot in the last few minutes that we have. I mean, there were a lot of comments in the chat, not as many questions, but so I didn't get a chance to bring on a lot of the audience. But, as I said, we represent that global cardiovascular community. Let's end with, what do you think the future of cardiology is? Or the global cardiovascular community? Yeah, I mean,
it's going to be a bright future, but it depends on where you put, it's 5-10 years or even beyond that. I certainly, it's going to be what we are facing now. It's a huge area of not only new technology, but how technology is going to be used, and particularly the whole world of digital, and if in a wide sense of artificial intelligence and all the areas that are impacting on healthcare as a whole, and certainly will impact on cardiology. But I would say that what we have witnessed over the last few years, the pace of new concepts, new technologies, new ways of managing our patients, of promoting healthy lifestyles, and so on. It's being so fast that I would say it's a bit difficult to predict how it's going to be in 10 years from now, for instance. But my impression is that cardiology would always be here, would always be very relevant to manage our populations in health and in disease. I do see a very step forward in terms of all the technological advances that will make a more precision way of sort of precision medicine, if you will, precision cardiology, particularly for some areas where we may have for instance, some genetic treatment and some ways of changing the course of some diseases and interfere in the natural history of some conditions. But and some of the tools that how could we imagine 10 years or even 20 years ago when we were at Stanford, Deepti, how could we imagine that today we would practicing cardiology as we do now compared to how it was some years ago? But I think there is certainly room for, I would say, a structured cardiology community to continue to deliver good healthcare to our populations, and to be engaged not only in the disease, but also that's the other area where I think we still have a lot to do in terms of prevention, and in terms of conditioning also some of the areas that can actually have an impact in the development of cardiovascular disease. Because if we have been good at treating, we have not been so good at preventing, and the numbers are there. We've reduced mortality for all the conditions that we treat and morbidity, but the prevalence of many of the risk factors, for instance, that have to do with the cardiovascular, and in this case, NCDs as a whole, is actually not doing so well in many parts of the world. So I think there's a lot of work to do, and I'm sure that at least in our lifetime, cardiology is still going to be a very strong area where there's going to be a lot of work to do, and we need to encourage and to engage and to stimulate our young generations to be involved in cardiovascular medicine and in cardiovascular conditions, because we're going to need that sort of group of people to help us sort out the best solutions for the future.
Stefan?
I can't use words as well as Fausto does, but I think the only thing that's really constant is change. There's no doubt that cardiovascular medicine will change. Artificial intelligence will impact what we do. Interventions will become completely different from what they are now. And also the new ways of delivering, whether you still call it drug therapy, like RNA interference, all of these things will completely change the way we practice medicine. But I think cardiologists will not be out of work. The cardiovascular system, now this is very simplistic from my side, right? The cardiovascular system is under constant stress, all the motion, all the pressure, all the flow, all the mechanics of it. There are some parts in the car that are much more likely to break than others. You know, a window won't break all by itself, while the engine will. Some parts of the car and some parts of the body are under more stress than others. So I think for the cardiovascular system, for cardiologists, we will never be out of work. But the way how we do things will certainly change completely. Whether we're still part of it, I don't know. But the one constant thing is change.
Well, thank you so much. I want to thank both my guests, Drs. Achenbach and Pinto, for joining us for this virtual ACC coffee table today. The recordings of these sessions are on the ACC YouTube page, typically a few days after the event. And I look forward to seeing many of you in person next week at ACC in Washington, D.C., and where we'll have a similar series called the Presidential Picks at the Heart to Heart stage. And I'll sit down with luminaries in cardiology. So I really invite you to be joining us there live. And for those of you that have joined me, you know that I always end all of my coffees with a toast to the future of cardiology, to our patients, and to the promise of the day ahead. So here we go. Bring up your coffee cup. May your coffee be strong. May your day be full. May we help. May we heal. And may we advance heart care worldwide together. Thank you so much for stopping by.
Thank you. It was a pleasure. Cheers.
Cheers. Thank you
And see you
guys
next
so
week.
much. Yeah, see you all next week. I look forward to it. And travel safe.
Thank you.
All right. Bye-bye.
Thanks, everyone.
Thank you, Dr. Chaporia.
And Cesar, I'm sorry I didn't get a chance to get you to ask a question. And Joe, and it's nice to see everybody. And that.
Bye.
Bye.
Have a safe
See you
weekend.
next week.
I
Thanks,
see you in
Skip.
Washington.
Yep, Frederica and Liana. Yep, everybody. It's so great to see everybody. I can't wait to hug everybody.
And what to see you, Dr.
This
Shaw.
has been a,
Beauty. Thank you.
Nicky, this has been a real pinnacle of your year. We appreciate it so much. Great series.
Thank you.